We're going to take you now to the United States, where there are also a significant moves to battle the spread of the Omicron variant. The Food and Drug Administration has just expanded eligibility for vaccine booster shots as kids return to school there. And there are new indications that it's part of an effort to combat the fast-growing Omicron variant, of course. CBC's Magda Gabriselassie is in Washington with more.
So more kids in the U.S. could soon be getting their booster shot. The Food and Drug Administration approved the Pfizer booster for children aged 12 and up. Now, it's expected that the Centers for Disease Control will follow through with that as well. Until now, in the U.S., anyone who was 16 years and older could get that additional shot. Expanding that now, it comes at a crucial time. We know that COVID hospitalization rates for kids are at an all-time high. And as for COVID cases across the board, the U.S. is averaging about 400,000 cases a day. The Omicron variant is to blame for the majority of that. And yet experts say the numbers will continue to go up.
I don't think you're going to start to see a national peak until we get into February, because there's parts of the country that really haven't been hard hit by Omicron yet, and the virus will spread around the country.
Meanwhile, the CDC could soon be recommending COVID-19 testing for those coming out of isolation. Now, this could be an effort to quiet some of the criticism that the CDC received last week after it recommended the isolation period go from 10 days to 5 days for those who had COVID but didn't have symptoms or whose symptoms had passed. Now, those people were still being told to mask up when going out after their 5 days of isolation. Here's Dr. Anthony Fauci, a member of the White House COVID-19 response team, defending that approach.
There's no doubt that you do want to get people out into the workplace if they are without symptoms. And in the second half of a 10-day period, which would normally be a 10-day isolation period, the likelihood of transmissibility is considerably lower in that second half of a 10-day period. And for that reason, the CDC made the judgment that it would be relatively low risk to get people out.
But now he says the CDC is now considering adding a new step, telling people to get a negative test result after those 5 days before they leave isolation. Magda Gabriselassie, CBC News, Washington.